Ever wonder if the pills you pop daily might be silently sabotaging your health? As we get older, it's super common to juggle multiple medications, sometimes three or four at once. But what many folks don't realize is that mixing certain drugs can create a dangerous cocktail, especially for seniors. It's not just about minor side effects like feeling woozy or a bit queasy. Some combos can lead to serious issues like internal bleeding, kidney damage, or even life threatening drops in blood pressure. Our bodies change with age, our liver and kidneys slow down, and the way we process meds shifts. A drug that was fine on its own in your 50s might turn risky when paired with another in your 70s. And here's the kicker: these risks can sneak up on you, sometimes with no warning until you're in the ER. Let me tell you about my Aunt Clara. At 68, she was taking a handful of pills daily, some prescribed, some over the counter. She thought she had it all under control, but one day she started feeling dizzy and weak. Turns out her medications were clashing in ways her doctor hadn't fully explained. It was a wake-up call for our family. That's why I'm passionate about sharing this with you today. Knowledge is power, and understanding these risks can save you from a world of trouble. The good news? There are natural alternatives that can help you cut back on risky meds while still supporting your health. These options are gentler, safer, and can work wonders when used wisely. Today, I'm diving into 5 dangerous medication combos seniors should avoid and offering 5 natural remedies you can discuss with your doctor to stay healthy and vibrant. Grab a notebook and let's get into it. This could be a game changer for your health and peace of mind. Number 1, blood thinners and aspirin, a recipe for dangerous bleeding. Seniors often take blood thinners like warfarin to prevent clots that could lead to strokes or heart attacks. Aspirin, meanwhile, is a go-to for pain relief or heart protection in low doses. Both are lifesavers on their own, but mix them without close supervision and you're playing with fire. Here's why. Warfarin thins your blood by slowing clotting factors in the liver, while aspirin stops platelets from clumping to form clots. Together, they can make your blood too thin, turning a small cut or bruise into a major bleeding event. For seniors with fragile blood vessels, this is especially risky. Imagine a minor bump leading to internal bleeding in your stomach or even your brain. Scary stuff. Signs like unusual bruising, nosebleeds, blood in your urine, or dark stools could mean trouble. My neighbor Tom ignored these signs while on this combo and ended up in the hospital with a bleeding ulcer. Don't let that be you. What to watch for: sudden headaches, weakness, confusion, or blood in your stool or urine. If you're on warfarin, don't touch aspirin or even supplements like fish oil or ginkgo without your doctor's okay. Regular blood tests, INR checks are a must to monitor clotting. Keep a list of all your meds and share it with every doctor you see. A pill organizer or medical alert bracelet can also be a lifesaver. Number 2, beta blockers and insulin, a sneaky threat to blood sugar control. If you're managing heart issues and diabetes, you might be on beta blockers to lower blood pressure and insulin to control blood sugar. These meds are critical, but together they can hide a serious problem. Beta blockers can mask the warning signs of low blood sugar, hypoglycemia, like shakiness or sweating, leaving you unaware until it's severe. My friend Sarah, a spry 72-year-old, learned this the hard way. She was on both and didn't realize her blood sugar was crashing until she nearly fainted at the grocery store. Beta blockers slow your heart and can dull your body's natural alerts for low blood sugar, making it tough to catch in time. For seniors, this increases the risk of falls or confusion. What to do? Check your blood sugar often, even if you feel okay. Keep glucose tablets or juice handy for quick fixes. Look out for subtle signs like fatigue or headaches, and talk to your doctor about adjusting doses or exploring alternatives. 3, opioids and benzodiazepines, a deadly duo for breathing. Chronic pain and anxiety are common in seniors, so opioids like oxycodone and benzos like Xanax or Valium are often prescribed. But combining them is like pouring fuel on a fire. Both slow down your central nervous system, which controls breathing and alertness. Together, they can cause respiratory depression, where breathing becomes dangerously slow or stops. I remember hearing about a local senior who mixed these meds and fell asleep, only to be rushed to the ER when his breathing nearly stopped. Seniors are especially vulnerable because our lungs and metabolism weaken with age, letting these drugs build up in the system. This combo also spikes the risk of falls, confusion, and memory issues. Stay safe. Never mix these without your doctor's strict guidance. Avoid alcohol or other sedatives, and keep your medication list updated to prevent mix-ups, especially if you see multiple doctors. 4. Diuretics and NSAIDs, a kidney-killing combo. Diuretics, or water pills, help with high blood pressure or swelling by flushing out excess fluid. NSAIDs like ibuprofen tackle pain and inflammation, but together they're a nightmare for your kidneys. Diuretics mess with electrolytes, while NSAIDs reduce blood flow to the kidneys, stressing them out. For seniors with naturally declining kidney function, this can lead to acute kidney injury. My cousin's dad ignored his swollen ankles, thinking it was just aging. Turns out this combo was taxing his kidneys. Watch for signs like swelling, less urine, or fatigue, and get blood tests to check kidney function. Instead of NSAIDs, ask your doctor about acetaminophen for pain. It's easier on your kidneys. Number 5, antihistamines and SSRIs. A risk for confusion and falls allergies, sleep issues, or depression might have you on antihistamines like Benadryl or SSRIs like Zoloft, but mixing them can amplify drowsiness, confusion, and dizziness, raising your fall risk. My mom's friend, Linda, started feeling foggy and nearly tripped down the stairs while on both. For seniors, falls can mean fractures or worse. Protect yourself. Opt for non-drowsy antihistamines like loratadine, or try non-drug fixes for sleep, like a bedtime routine. Talk to your doctor about adjusting SSRI doses to minimize side effects. Now let's talk natural alternatives. You don't have to rely solely on risky meds. Here are 5 natural options to discuss with your doctor. 1. Omega-3 fatty acids, fish oil. Instead of NSAIDs for joint pain, try omega-3s. They reduce inflammation, ease arthritis pain, and boost heart and brain health. Studies show 1 to 3 grams of EPA-DHA daily can rival low-dose NSAIDs without the kidney or stomach risks. Choose a high-quality, purified supplement to avoid contaminants. Number 2, turmeric, curcumin. Turmeric's curcumin is a natural anti-inflammatory that can help with arthritis or chronic pain. Unlike NSAIDs, it's gentler on your system. Look for supplements with piperine to boost absorption and aim for 500 to 1,000 milligrams daily per your doctor's advice. 3. Magnesium. For blood pressure or sleep issues, magnesium is a game changer. It relaxes blood vessels and calms nerves, helping with hypertension, cramps, and restless nights. Foods like spinach or nuts are great, but supplements, 200 to 400 milligrams daily, can fill gaps. My uncle swears by it for leg cramps. 4. Chamomile tea. Struggling with sleep or anxiety? Chamomile tea is a soothing, natural sedative. Its apigenin calms the brain, helping you drift off without the grogginess of pills. A nightly cup became my go-to ritual for unwinding. 5. Probiotics. Gut health impacts everything, especially as we age. Probiotics restore beneficial bacteria, easing digestion and boosting immunity. They can prevent diarrhea from antibiotics and keep you feeling vibrant. Look for strains like lactobacillus or bifidobacterium in yogurt or supplements. Wrapping up, mixing meds like blood thinners with aspirin or opioids with benzos can be a silent threat, but you can take control. Stay vigilant, keep a medication list, and talk to your doctor about natural options like omega-3s, turmeric, or probiotics. These small steps can mean big wins for your health. Aging well is about smart choices. One pill, one supplement, one conversation at a time.